patients deal with their health problems better if they have a full understanding of what's ailing them.
For the next few weeks, we'll be talking about medical conditions and the latest treatment methods available within the help of the best specialists in the country.
And as patients like myself, we need to know the best way to treat and manage these ailments. Right, Doc?
That's correct, because you should always be actively involved in matters as important as your health.
You see, more often than not, most patients just agree with what their doctors say because they're afraid to ask about the real conditions. But in this show, we as patients are free to ask what we want to know and what we want to say.
And we encourage you to participate because you as patients, the more you ask and talk, the better we doctors can help you. Your health really depends on you and me. I'm Dr. Oyi Balburias.
And I'm Maricel Laksa Pangilinan, and it's time to
Talk to Doc. Our topic for today is regenerative medicine. Regenerative medicine may already be a big thing in other countries, but it's just beginning to make waves here in the Philippines.
Here is one case that was treated through regenerative medicine. Regenerative medicine is the field involving the engineering of cells for the purpose of preserving, restoring, or enhancing organ function. One such patient who underwent stem cell regeneration is former Labor Secretary Nieves Confesor.
It was about the end of 2005. I noticed that I was making hingal so fast. I mean, really. And I could not work as much as I could before. I would get very tired very easily. And I would have chills in the evening, at night, at 1 o'clock, 2 o'clock. So we said, there's something wrong. So they started looking for what was wrong. It took them about 5 months.
After doing a series of tests, she was diagnosed with stage 1 leiomyosarcoma, a rare form of cancer in her uterus. She underwent surgery, chemotherapy, and radiotherapy in June 2006.
One time when they looked, they CT scanned me regular, they found a spot in my lungs, and that they took a biopsy of it, and they found that it had the same thing as what they took out in my uterus, so which means it had moved. And so that one meant another operation also here at Medical City. But at the time, my oncologist said, and also the guys over at the Sloan Kettering was saying chemotherapy was not the thing to do for something. It was not very effective for my kind of cancer. And this time we decided we'd take on Dr. Bernal and his stem cell regeneration therapy.
In 2008, stem cells were collected from Confesor's blood and were transformed into fighting cells, attacking the cancer cells in her body.
So they harvested my stem cells, and they also harvested my cancer cells when I had the operation. And that was they did something in the lab. It was maybe a get-to-know-you kind of thing. Yeah, get to know your body, you know. And after some time, they injected it back to me, my cells. Now they're called smart cells. And every 4 or 5 weeks, so 6 shots of them. So every 6 months, I have my tests again. And they check whether they're at the level that was comfortable.
2 years after the treatment, Confesor is again doing the things she did before. Juggling career and family life, plus having a grandchild to play with.
Each one of us will have to make that decision. I think part of the work really of a doctor, and that maybe that's why it's very hard to be a doctor now and also oncologist, is how do you manage your patient? You have to manage also my how do you call it? My health, my psychological health. Because remember, going through all of that is not a joke. It's very life-changing. Yeah, at the same time, you're also trying to change. The reason also for me going to stem cell was I knew it's an area it's a new area. It's part of the discovery. So I said, well, might as well make myself part of the discovery.
Doc Oyi, after watching that video, I'm I'd like to know if all women are predisposed to developing uterine tumor, or are there specific risk factors to look out for?
Those women who have prolonged exposure to estrogen, those who have early onset of menstruation, those who have prolonged onset prior to menopause, those who have not given birth, those who have problems like with infertility, and even obesity can be a risk factors.
Oh, ayan. At least we know now, di ba? After this break, we'll find out more about regenerative medicine and why it's considered the best treatment option for this specific case of uterine tumor and other health conditions.
Let us know what you think and we'll give you the answers in just a bit. Stay tuned and we'll be right back.